Hi guys, welcome to my channel. Before we get started, make sure to hit that like button and also subscribe to my channel. So make sure to watch the full video. There are numerous resources for pregnancy information. At your initial prenatal appointment, your doctor will probably hand you armloads of pamphlets covering each test and trimester. Despite all this knowledge, there are 10 typical surprises that pregnancy can bring. 1. The nesting compulsion. Many expectant mothers experience the nesting instinct, a strong drive to organize and tidy their homes in preparation for the newborn. You could find yourself doing things you never would have imagined doing in your 9th month of pregnancy as your due date approaches, like washing walls or cleaning cabinets. Your list of things to do after the delivery will be smaller thanks to your drive to get your house ready, but take care not to go overboard. 2. Concentration issues. Many women experience exhaustion and mental fog during the first trimester due to fatigue and morning sickness. However, even well-rested pregnant women may experience memory loss and attention problems. Hormonal changes and pregnancy-related thoughts are factors. The baby and the impending birth could feel more significant than everything else, including work, bills, and doctor appointments. You may remember appointments and dates by making lists. 3. Swings in mood. Pregnancy and premenstrual syndrome are similar in many ways. Your hormones fluctuate, you may feel moody, and your breasts swell and become tender. If you suffer PMS, your mood fluctuations during pregnancy may be more extreme. They have the power to turn your mood from one of happiness to one of crying suddenly. Mood changes are quite typical throughout pregnancy. As the 3rd trimester draws to a close, they tend to occur more frequently. Depression is a common pregnancy condition. Consult your healthcare provider if you experience symptoms like restless sleep, altered eating patterns, or mood swings for more than 2 weeks. 4. Size of bra. One of the initial indicators of pregnancy is a growth in breast size. Estrogen and progesterone levels are higher during the 1st trimester, which causes breast growth. Your breasts could continue to expand throughout your pregnancy if they did throughout the 1st trimester. Your ribcage may also have an impact on your bra size. Your lung capacity rises during pregnancy to allow you to absorb more oxygen, which could result in a larger chest size. Throughout your pregnancy, you might need to purchase new bras several times. 5. Skin alteration. Are your pals noticing the pregnant glow on you? It is just one of the many consequences that can result from hormonal changes in skin stretching. Increased blood volume in pregnant women allows for increased blood flow to the kidneys, uterus, and other organs. Greater volume increases oil gland secretion by bringing more blood to the vessels. Closma, sometimes known as the mask of pregnancy, is a condition in which some women get brownish or yellowish blotches on their faces. And some people will see the linea negra, or linea negra, a dark line that runs down the lower abdomen's midline. Additionally, the nipples, external genitalia, and anal region may exhibit hyperpigmentation, darkening of the skin. This is because hormones associated with pregnancy encourage the body to produce more pigment. Due to the possibility of uneven enhanced pigment, the darkened skin may look as color splotches. Wearing sunscreen and avoiding UV light can lessen the effects of closma, which cannot be prevented. Because the skin's sebaceous glands produce more oil during pregnancy, acne is frequently encountered. Furthermore, any moles or freckles you had prior to becoming pregnant may become darker and larger. After you give birth, the majority of these skin changes ought to disappear. Many pregnant women also experience heat rash brought on by perspiration and moisture. In general, a woman may experience itching during her pregnancy. Itchy skin and flaky skin could result from the abdomen's skin expanding. To relieve dry or itchy skin, your doctor may suggest lotions. 6. Cosmetology. Several women experience changes to their hair's texture and growth while pregnant. Your hair may grow more quickly and hormones may reduce thinning. However, these hair modifications are typically temporary. After giving birth or after they stop nursing, many women have temporary hair loss. Some women discover that they develop hair in unfavorable areas, such as on their faces, bellies, or nipples. Hair might become drier or oilier due to changes in texture. Even some ladies see their hair's color shifting. Similar to hair, nails can alter during pregnancy. Additional hormones may accelerate their growth and strength. But for some women, pregnancy makes their nails more prone to splitting and breaking. 7. Shoe size. You still have your shoes, even though none of your pre-pregnancy clothing fits you anymore. Possibly, but possibly not. Many pregnant women have swollen feet and need to wear larger shoe sizes due to the extra fluid in their bodies during pregnancy. In the summer, wearing slip-on shoes in a larger size may be more comfortable. 8. Joint flexibility. The hormone relaxin, which is produced by the body during pregnancy, is thought to aid in preparing the pubic region and the cervix for delivery. Your body's ligaments become more supple as a result of relaxin, making you less stable and more prone to injury. Particularly the joints in your knees, lower back, and pelvis are susceptible to overstretching or tension. Avoid quick, jerky motions when working out or moving heavy objects. 9. Constipation, hemorrhoids, and varicose veins. Blood collects in swollen veins caused by pregnancy hormones to form varicose veins, typically present in the legs and genital region. After delivery, varicose veins commonly disappear. Avoid standing or sitting for extended amounts of time to help prevent them. Put on loose-fitting garments. Utilize support hose when sitting, lift your feet. Additionally, typical during pregnancy are hemorrhoids or varicose veins in the rectum. Your uterus is pressing against your pelvis, and your blood volume has grown. Thus, the veins in your rectum may enlarge and group together like grapes. Particularly during or right after a bowel movement (BM), hemorrhoids can be excruciatingly uncomfortable, bleed, itch, or sting. Another typical pregnant ailment is constipation. It occurs because pregnant hormones impede food movement through the digestive system. Making a BM in the later stages of pregnancy could be challenging because your uterus may press up against your big intestine. Constipation can make hemorrhoids more likely because straining to urinate can enlarge the rectum's veins. Preventing hemorrhoids and constipation is the best course of action. Regular exercise, a diet high in fiber, and a lot of liquid intake each day can all assist maintain regular BMs. Also helpful are stool softeners, not laxatives. If you have hemorrhoids, ask your doctor about a lotion or ointment that can make them smaller. 10. Physical changes associated with labor. As a result, you believe your surprises are over after and during the mood swings and hemorrhoids. The biggest surprises will likely occur on the day you give birth. In the amniotic sac during pregnancy, fluid envelops your unborn child. At the beginning or during labor, this sac ruptures, which is the same time your water usually breaks. Contractions typically begin for most laboring women before their water breaks. In some cases, when the cervix is already dilated, the doctor must purse the amniotic sac. What volume of water can you expect? About 2 to 3 cups of amniotic fluid are present for a full-term infant. Some women may experience a strong urge to urinate, which causes their water to burst in a flood of liquid. Others might only notice a trickle running down their leg as a result of the baby's head acting as a stopper to contain the majority of the fluid leakage. Amniotic fluid typically has a sweet fragrance and is either colorless or pale. You will continue to leak fluid at a rate of around a cup per hour until birth, since your body replaces it every 3 hours. During labor, other unanticipated things could leave your body. Some females experience nausea and vomiting. Others experience diarrhea prior to or during labor, and gas is also typical. You cannot control your urine or bowels when labor is in its pushing stage. Your wishes for handling these and other aspects of labor and delivery can be communicated to your medical professionals with a birth plan. There are many surprises in store for you while you are pregnant, but none will be sweeter than the feeling you'll have while holding your unborn child in your arms. So that's it for today. We hope you enjoyed the video. Use the comment section below to tell us your thoughts about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.